Welcome everyone to our discussion on COVID-19 and armed conflict. I'm Priyanka Motaparthy, the director of the Project on Armed Conflict, Counterterrorism, and Human Rights at Columbia Law School. I'll be moderating today's discussion. Today's event is part of the COVID-19 Advancing Rights and Justice During a Pandemic virtual event series that is convened by the Columbia Law School Human Rights Institute, Duke Law's International Human Rights Clinic, Columbia Law School's Center for Gender and Sexuality Law, and Just Security. As we have learned during the course of this pandemic, while we are all vulnerable to both the virus and its many ripple effects, we are not equally vulnerable. Factors such as poverty, lack of access to healthcare and clean water, living in densely populated areas, and historic inequalities, all of these have magnified the scale of harm. In some very stark ways, this pandemic has magnified and brought into relief society's harshest inequalities. We have seen this play out on a very local scale in New York City, on a national scale, and we have and continue to see these inequities play out on a global scale. There may be no populations for which we have greater concern than those living in countries affected by armed conflict, where health systems have often been decimated by years of war. Supply chains for essential goods and humanitarian aids are disrupted or manipulated, and large numbers of people live in close proximity, particularly in displacement camps. There are significant risks for detainees, including prisoners of war and political prisoners. And there are endemic problems: the health and rights of vulnerable and marginalized groups in the countries at war, conflict-driven spending, and corruption. Some of the threats are clear and some may be less obvious. At the same time, the fears around the threat this virus presents could help drive collective action. The UN Secretary General has called for a global ceasefire, and at local levels as well, we may see more opportunities for peace and appetite for dialogue than at any time in prior years. We have with us today an excellent group of speakers who can provide us with very different perspectives on both the threats and opportunities to better protect the lives of those living under conflict. They are Kate Kizer, Policy Director at Win Without War, Azadeh Moaveni, Director of the Gender and Conflict Project at the International Crisis Group, Cordula Droege, Chief Legal Officer at the International Committee for the Red Cross, and Farea Al-Muslimi, co-founder and chairman of the Sanaa Center for Strategic Studies. Each of them will speak for about 8 minutes, and then we'll have a Q&A session for the remainder of our time. Participants can tweet questions using the hashtag COVID-19 Justice, or by using the question and answer function in Zoom. We look forward to receiving your questions. Kate, why don't you start us off?
Thanks, Priyanka. Hi, everyone. Thanks for joining us today. I'd like to start off with some general framing of the crisis that we face and the need for bold structural changes to not only how the US conducts itself on the world stage, but also international cooperation writ large. As Priyanka alluded to, this crisis truly has revealed deep weaknesses in the current and political order, both here in the United States as well as internationally. And we've already started to see certain actors try to take advantage of the crisis and chaos it's created, from authoritarian power grabs in Hungary to the border closure announced by tweet last night by Donald Trump. And what's needed is really a fundamental rethinking of security and a social compact between people and their governments. And Win Without War is a national grassroots advocacy organization, and we put out a call of 5 demands for US foreign policy to really fundamentally rethink how the United States shapes security. For at least the last 2 decades, if not longer, the US has really focused on a investment in maintaining military dominance around the world as a means to build security. Fundamentally, that approach has relied on policies that make others less secure to purportedly make Americans more secure. But what that's resulted in is the United States fighting endless wars in dozens of countries around the world, one of the greatest mass displacement crises we've faced since World War II, and growing levels of a pernicious nationalism and racism here at home, all while ignoring one of the greatest transnational threats we all face in the climate crisis. And so the 5 demands that we outlined, we believe that this crisis, this global health crisis, really presents an opportunity for a fundamental paradigm shift in US foreign policy that, if actually invested in wholeheartedly, could also lead a fundamental reform internationally in how different countries interact and prioritize building security, not only for citizens within their own country, but also prioritizing safety and justice for all around the world. First and foremost, that looks like not investing $1 more in weapons of war, endless war, or the Pentagon. The United States invests nearly $1 trillion per year in the military and defense manufacturing, all of which to further its military dominance around the world. But ultimately, the growing transnational crises that we face in the 21st century, from this global pandemic to things like the climate crisis, fundamentally do not have a military solution. And so we need to first and foremost think about how we are funding not only physical security, but economic security. And that requires deep structural investments, not only in things like democratic reform, but also economic resiliency, healthcare, and other mechanisms that will actually build holistic human security for people around the world. And we should also be prioritizing building that for other people around the world, because that is the primary way to mitigate violence and prevent conflict, rather than fueling more conflict by thinking that we can bomb our way to peace. Second, the US has really weaponized the US financial system, particularly under Donald Trump, but this has been going on for years, through a web of mass, often sectoral sanctions on countries that it wants to change its behavior. And more often than not, these broad sectoral sanctions often harm the people most vulnerable in these societies, whether in Iran, North Korea, or Cuba, as well as other countries like Venezuela, that the current sanctions regime that the US has on these countries only compounding the health crises that regular folks face in these countries. So first and foremost, the United States should immediately suspend sanctions, at least temporarily, for the duration of this crisis, and then ultimately end them. Because the academic literature actually shows that sanctions more often breed corruption and authoritarianism. And so if the goal of US sanctions is actually to create policy change, to end human rights abuses, to foment democratic governance and accountable governance, then we should be actually investing in other tools to facilitate that change that actually uplifts movements within these societies who are demanding change on their own terms. Third, one thing that this administration has been doing for several years, and obviously has only been compounded by this crisis, is the gutting of the United States refugee and asylum programs. We've seen his, tweeting about his border wall, diverting Pentagon funds to build the border wall, basically ending the refugee program by lowering the cap so low, denying people asylum and sending them back to unsafe countries. And so first and foremost in this crisis, if we are to be more secure, well, no matter in what country we are living in, we have to recognize that we need to be welcoming and defending the rights and dignity of those seeking safety outside their countries of origin. Ultimately, we can become more safe if we're providing refuge and protections and humanitarian assistance versus creating humanitarian crises on our borders like we're doing right now at the US southern border. Fourth is prioritizing international cooperation instead of competition. We've already seen pundits from kind of all different sides of the political spectrum blaming China for this crisis, which has further calls for more militarization of the US competition with China and the claimed threat that the rise of China poses to US power. But ultimately, again, these shared security challenges that we all face, from the climate crisis to global pandemics to things like grand corruption and growing authoritarianism, cannot be solved by ending international cooperation, gutting the multilateral system, and militarizing our way out of this problem. We have to be investing deeply in international cooperation to create coalitions of countries acting for the same goals. And fundamentally, if we allow fear-mongering to cut off opportunities at cooperation, we ourselves will be less safe, because we will be cutting off vital lifelines that we need to address these shared security threats like climate change. And finally, because of the fundamental flaws that this crisis has revealed in our system, and to prepare for the crises of the future and the seismic shifts that are going to occur from things like the climate crisis to the US and global economies, we should be investing in a green just transition now through things like a Green New Deal. Ultimately, we know that the climate crisis is coming. The UN has said we have 10 years to actually mitigate the worst effects of the climate crisis. And so if we do not start preparing now, we will be yet again left flat-footed in the face of another grand scale crisis. And so because this crisis has really bottomed out the US and global economies and threatens to do even more pain than the Great Depression, it's a prime opportunity to actually fundamentally rethink how we build an economy that no longer just serves the interests of elites and corporations, but actually focuses on the needs of workers and regular people and puts environmental protections at the forefront. This not only can help us mitigate the climate crisis, it can forward a new social compact between people and their governments that undermined the flavor of nationalism that we're seeing take hold around the world, and also end the focus on military means of security that have led the US to fuel conflict around the world. So I will leave it there. It's kind of a larger picture framing. I know a lot of my panelists colleagues will have some other great framing.
Thank you so much, Kate, for that look at what we could be doing with US foreign policy and a different way forward that could be better envisioned and better actualized through the vehicle of this pandemic. Azadeh, let's turn to you now. Can you share with us what you have seen in your work as some of the both the biggest threats and some of the opportunities presented by this crisis?
Absolutely. Thank you, Priyanka. And just to say quick, it seems to go out every 4 minutes for some reason, but then it comes back. So hopefully you can hear me. And thank you, Kate, for that framing. I think I'll speak to two countries that can kind of look at that kind of essentially that theoretical framing in some specific context. Certainly, Kate mentioned Iran, and I'll talk about Iran to start with. It has been the country most severely impacted in the Middle East by the virus. It was also the most uniquely vulnerable, potentially, when the virus struck. Its economy was straining heavily under the weight of US sanctions, along with domestic mismanagement. The government was quite slow to respond, although in retrospect, many governments were quite slow to respond. But once it realized the scale and the scope of what was happening, it was hampered by US sanctions in responding in a way that really did bring about total calamity for the country. setting up some of the context, a large percentage of the Iranian population, like many developing countries, relies on daily labor to be able to feed itself. So shutting down the economy without being able to implement like a massive social safety net, which Iran simply can't afford to do right now, wasn't feasible. The country's working poor, who have been most impacted by the economic crisis, were already suffering malnutrition, ill health, as a result of the declining economy when this hit. So they were physically more susceptible to begin with. And I imagine the case is very similar in places like Venezuela. So at the height of the pandemic in Iran, on Persian New Year, for example, that was a day when an Iranian was dying every 10 minutes from the virus. The figures today, because of the lack of testing, are 83,000 confirmed cases and over 5,000 deaths. But I think we know that it is at least certainly a few times that. So the big difficulty for Iran, which it was facing before the pandemic, but that was exacerbated by it, was its inability to purchase humanitarian goods on the international market as a result of US sanctions. We had been seeing the impact of that with the treatment of pediatric cancer patients who were dying before the virus hit. And when this unfolded, the inability to buy drugs, medicines, and the ingredients that Iran needs to build into a lot of the resources that it needs were simply out of reach. There is a Swiss-sponsored channel that has been meant to facilitate humanitarian trade. I think hopefully it's back. Yeah, okay. This Swiss-sponsored channel hadn't processed, that was intended to allow Iran to bring in humanitarian goods under US sanctions, had not processed a single transaction before COVID hit. The demands by the US were simply so onerous that many who were working with it, trying to get it to work, including the Swiss, just simply felt like it was designed to be unusable. So in practice, this sort of meant that Iran was not able to bring in what it needed. Iran has a quite sophisticated manufacturing base. The result of years of isolation has been that it's developed a quite independent manufacturing base. So it can make certain medicines, it can make some PPE, it can make disinfectants, but it does need to rely on external supply chains to bring in some of the ingredients for that production. But for Iran to simply find new suppliers, scale up, get more goods into the country as it needs, as every country sought to do when COVID-19 unfolded, was out of reach for Iran. It simply couldn't. And quickly to explain why, the imposition of secondary US sanctions, which means simply the way that they impact non-American trading companies around the world, has really meant that transport into Iran of goods is very compromised. Airlines, shipping companies have backed away from the Iranian market. So it makes it hard for Iran to move goods even physically into its airports and ports. At the end of February, when the WHO was trying to get COVID testing kits into Iran, it struggled. It tried to fly them in through the UAE. It couldn't. It had to send them to Iraq and try and fly them in through Baghdad eventually. Even at that moment, at such urgency, it was a struggle to get things into Iran. Delivery aside, the licenses that companies have to apply for from the US Treasury to be able to get certain products, medical exports specifically into Iran, are onerous. Things like oxygen generators, facial respiratory masks, thermal imaging equipment. These are things that were important to Iran's COVID response. But companies have to apply for special licenses to be able to process those transactions. Just to give you a sense of the state of that, in early 2019, only 10% of these kinds of special licenses were being approved by the Treasury. For those who are old enough to have worked on Iraq during Oil for Food, this kind of decline of a theoretical humanitarian program, like death by 1,000 bureaucratic pinpricks, will be very familiar. Leading us to the biggest problem of all for Iran is banks. Banks just won't facilitate financial transactions for Iran. There was some criticism of Iran at the outset of the outbreak for not accepting some one-offs of charity. And the point that Iran's leadership was trying to make at that point was that it didn't really need one-offs of charity. It needed to be able to use its own money to buy what it needed to protect its own people from this pandemic. And to be able to do that, it needs to be able to use the banking sector. It needs to be able to process transactions through banks. So the INSTEX channel, that humanitarian aid channel that I mentioned earlier, has really only got up and running in the last few weeks. And we can see that, you asked Priyanka, what are some of the opportunities being presented by the pandemic? Sort of one aspect is this, real sort of deadlock between Iran and the United States. And it seems like Europe in particular has been spurred into some action in sort of getting this humanitarian channel up and running because it's working. We've seen some political dynamics changing, and perhaps when Iran pushes, it's applied unprecedentedly for a $5 billion emergency loan from the IMF to aid its response. Perhaps we'll see some support for it securing that loan. If I have just a couple of minutes, if I may, well, then I will be very, very brief. We know that displaced populations are especially vulnerable to outbreaks of disease. And at Crisis Group, we've worked quite a lot on Syria, both the Northeast and the Northwest, and have identified it as one of the most high-risk areas of active conflict that will be vulnerable to COVID. I think alongside Yemen, which we'll be hearing about imminently, I think. And it probably, these areas of Syria share themes with Yemen in that they were already experiencing massive health crises, health infrastructure completely destroyed by years of war, not rebuilt, already looking at situations in displacement camps that were humanitarian disasters before COVID unfolded. We've been in touch with and have written about particular camps in Northeast Syria where 70,000 IDPs, and most of them women, and we do kind of stress that there's a real gender differentiated impact to the experiences of IDPs, and we anticipate it will be with COVID because the majority of them are simply women. So panic, women unable to access even health information, trying to text relatives from around the world to figure out what to do. A very, very sort of dire and scary predicament for them because they're already cut off, already finding it difficult to access services. This problem exists also in Iraq, and again, disproportionately felt by women because of stigma associated with perceived or potentially real affiliation with armed. Take this as a nod to add up, but that this is a very serious problem for displaced populations who also in certain places in Syria certainly, and this will be my last point, are dependent on aid that is dependent on politics, because even the politics of getting aid into Syria gets decided at the UN Security Council, where Russia and other countries are battling out big picture political problems with each other in ways that will impact these very vulnerable communities.
Thank you, Azadeh, for both that look at the situation and the impact of sanctions on Iran in the current situation, as well as a look at displaced populations. And I think your comments really reminded us that, what conflict has really taught us is that it's not only about the urgency or scale of humanitarian need or human suffering. It is also very much about those politics that are governing what can come to countries in need and what people can access, no matter how dire the needs on the ground are. Now we'll turn to Cordula, who will give us a look at the international legal framework, and in particular, the principles that the ICRC is emphasizing in the current crisis.
Thank you very much. Hello, everyone, and thank you very much for inviting me to be on your webinar. It seems to be working very well so far, so good. So you've asked me to talk a bit about the legal framework and particularly, of course, in situations of armed conflict. So where international humanitarian law applies. I'll try not to use too many acronyms, but I do talk about IHL a lot. And I have 2 points basically. My first point is that the vulnerability of people to pandemics is differentiated between different people in populations. This is the case in peacetime as well as in wartime. You have a health impact on people, and then you have a direct socioeconomic and so on impact, in particular, of course, now with all these lockdown measures. And so it's of course not surprising that in situations of armed conflict where you have extremely vulnerable populations, the impact of a pandemic is exacerbated because not only are people vulnerable, but that's perhaps the one thing that I want to stress very much is the infrastructure is slowly but surely eroded over the years of conflict. And most of the conflicts that we see today around the world are what we often call protracted conflicts. So they last over many, many years. Now, of course, every conflict will always come with its toll of suffering. Even if all the rules are respected, conflict will, erode infrastructure. People will be killed. People will be wounded. The coping mechanisms will erode social fabrics. But we also know that a lot of the vulnerability of people in armed conflict, and in particular now in the situation of pandemic, which requires essential services, is due to the lack of respect for the rules of war, for international humanitarian law, in the sense that to combat a pandemic, you need essential services, you need water, you need sanitation, you need medical care, healthcare, and you need staff. All of these ingredients for a response to a pandemic are often falling victims of the activities of belligerents in an armed conflict. So for instance, the rules on the conduct of hostilities require belligerents to respect distinction, proportionality, precaution. And yet we know that over the years in conflicts like Yemen, like Syria, like the DRC, hospitals have been deliberately targeted, water installations have been targeted, electricity has been damaged. We know that the use of explosive weapons, explosive weapons with a wide area effect, even when used against military objectives, and even if it isn't per se unlawful, has had such humanitarian consequences that it raises serious questions about the way belligerents have respected the principles of distinction and proportionality, with the consequence that in places like Yemen or Syria, more than half of the hospitals are actually out of order or destroyed, in Iraq, in the DRC, etc. So the vulnerability of people in armed conflict comes from years of disrespect for international humanitarian law also. And it is, it's been repeated many times over that the indirect, the third and the second and third tier effect of conflicts are just as stark in armed conflicts as the immediate suffering. And it seems to me that COVID-19 is an illustration of exactly that phenomenon. These consequences are foreseeable, and they are the result of choices by the belligerents in armed conflict. So the situation of vulnerability we are in is a result of those choices. Now that leads me to my second point, which is quickly made and in a way flows very clearly from the first one, which is let's not exacerbate these vulnerabilities even more. When designing the response to the pandemic, it has to be done based on human rights and based on international humanitarian law. A public health response will only be effective, but also only be humane if it is human rights based and IHL based. And so in particular, there has to be respect, first of all, for the rules on the conduct of hostilities, so that essential infrastructure and essential services can work and respond to the needs of populations. There has to be particular respect for the medical mission, for hospitals, for hospital staff, medical relief, and medical care has to come without any distinctions other than based on medical criteria. And of course, also there are many rules in international humanitarian law and international human rights law protecting the particular groups in the population to be received with adequate shelter, food, hygiene, and sanitation. And yet, of course, we know this is often not done. You have rules on persons with disabilities who are particularly impacted also in a pandemic, on children, on women, and all of these rules should be respected in designing the public health response. Now, Priyanka, just as a last point, perhaps, because at the very beginning you were talking about opportunities and risks also from this pandemic for respecting the rules, and I think there are opportunities and risks that we see. So, for instance, I think we've seen that in places of detention, in displacement camps, there's been particular efforts being made also by certain authorities to improve the situation. So when you look, for instance, in places of detention, which are places the ICRC works a lot, you know, a lot of water installations have been installed very quickly. Soap is being distributed. There've also been actually many states that have released detainees, sometimes by the thousands, you know, either through pardons, through early release, etc., of certain perhaps less threatening populations, if I may call it this. There's also, you know, of course, the public health measures of installations will impact family links, but there have been quite interesting ways of re-establishing family links with the outside world for detainees. There's also been an interesting phenomenon of non-state armed groups having to all of a sudden take on almost, you know, state-like functions, having a public health response, establishing quarantines, specific, you know, quarantine places, etc. So that also creates an opportunity, I think, to speak with those groups and to engage in a good dialogue. So there are, I think, also opportunities in there, but there are, of course, also the difficult threats and risks that we saw. Kate has talked about them. Azadeh, I would say, and I can perhaps come back to it later in the Q&A, we have risks for humanitarian access because of all the compounded obstacles which were already counterterrorism measures, sanction regimes, and now you have public health measures, which are, of course, legitimate. But it's very much often about a balance to be found. And perhaps my last thing on that is that we have heard a lot about, you know, states of emergency, war metaphors, and the war metaphor for a pandemic is, of course, very understandable. And often we speak about people who are on the front line, like health workers, and we want to speak about it like this because they kind of are, and we want to support it. But we also, I think, have to be aware that the war metaphor can also be risky because it sort of implies that extreme measures are possible. And so there's a risk of such extreme measures actually being taken either through, you know, arbitrary detention, excessive use of force, you know, certain agendas about, you know, completely undermining asylum rights, etc., etc. And so we have to be careful also about the choice of our words. Words matter in this as well, I think. Thank you.
Thank you so much. And that was an important point to end on. Words do matter, and the actions of governments that are taken during this time of crisis could, of course, last much longer than that. With that, let's turn to Farea. Farea, we're really looking forward to your comments on Yemen, which we understand the WHO announced the first documented case of coronavirus in Yemen about a week ago, but the spread has, as far as we know, remained relatively small. Can you give us your take on the situation there and what we should be looking for and what we should expect?
Sure. What I would first, thank you very much for the invite and everyone, and for having a man quota in this exceptionally women panel, which is quite amazing. Thank you for considering that gender balance. That being said, I do want to, I can talk a bit about what you asked for, but I also want to point out almost on what the speakers before me were building as a case. And I think one of the most important things we have seen in this part of the world is how regimes and governments have used the pandemic actually in a way to shut down social movements, to shut down political rights, and almost to thrive as a non-state actors, but also as a war sites in sometimes. And in a way, how this pandemic have shifted sometimes social movements is a quite unbelievable somehow in the region. I live in Lebanon and since almost 10 years in total. And from October last year, we saw an unbelievable social movement that actually shook the entire sectarian system in the country. And nothing was able to stop it actually, except Corona. And this really now the streets is over and sectarian groups are very happy and actually much thrilled that there is something who took people out of the street for them. You look, for example, around you into the region and you look into a country like Jordan, putting also emergency laws, which is already a police state. When you look into the measures, what they put together actually to also thrive as a regime, but also to make this conversation as almost a military police state conversation rather than a public health one. It's a quite amazing what you've seen. For the first 3 days, for example, of the lockdown, how the government shut down everything. And the Minister of Information in TV told people, you know, like 3 days, we're gonna give you breads and toilet paper and even cigarettes, you will start distributing it. It's a version of 1984, older brother. You know, we know how many times you're even going to the bathroom. We know how many cigarettes you need a day. And it's a striking in a way. And when you look, for example, into the response there, it fits very perfectly in USAID measures. And actually a lot of countries are looking up for this, for the way how Jordan actually is dealing with the pandemic. But you know what ultimately did is, even in the speech of the king, half of it is actually thanking armed forces rather than the doctors and nurses. But it tells you how regimes were able to build on it. You walk a bit around to Algeria, for example, and you have a revolution there that was actually shook up also a regime that was one of the bloodiest and actually most corrupt and strongest that have survived the first Arab Spring wave. What actually helped get people out of the street in Algeria? Again, Corona. So it's a way of how you see, even for example, the Saudis were able to allocate who are their citizens that goes to Iran without also visa security by tracking down those who actually had the coronavirus at the beginning. So you can see how some sort also in the neighborhood where I live, you get all different sectarian groups walking around, for example, with their microphones, but also, you know, with some services trying to, yes, sometimes open a door, but also replace the state and find a narrative of their own to replace the state. That's a similar also in the region somehow, despite the pandemic going home. Iran has not really behaved in the region. It's still meddling in countries, despite what it's facing internally. You look the same to Saudi Arabia. It has shut down most of the planes into the country, or basically all the movement. But there are still one type of planes that not stopped, and these are the planes flying over Yemen, bombing Yemen. So somehow, some sort of these regimes, despite the urgency and the indifferent, or probably the massive scale of how crazy this is, they're still not behaving as they should be, even in the most or in the least possible indicators. That applies to Yemeni sides. You know, you see how the Houthis are looking into it, for example. They obviously even further using it to say the only front lines, the only place in Yemen actually where is corona-free is the front line. So using it even as a measure to take youth actually to fight with them. There isn't so far, neither from the Houthis nor from the government, any sense of urgency or indifference, or I mean, any sense of really how this, because they need to do a lot of things, including, ideally, including, for example, listening to the UN call and releasing all the prisoners. This is something there, and this is something possible, and they need to do it as soon as possible. Houthis never really considered that or really care about it. Similarly, the Yemeni government have not really done what it should be doing, for a lot of reasons, obviously. I think, however, the one thing that this brings is, you know, as many speakers before me have pointed out very eloquently, is it is an opportunity in a way if there is enough international pressure around ending these kind of stupid wars, more or less. This creates, for example, a momentum around what the UN envoy have been doing in Yemen. In a way, if you have the right diplomatic architect and the right countries behind diplomacy on Yemen, I think this is also an exceptional face-saving chance for Saudi actually to say, okay, there is something bigger and now we're gonna move with it. And that applies to the other side. You have a health system that's already destroyed in a way. This is not going to be easy or hit. You see how this have already hit countries with a strong health system or better, let alone a country where 80% were already in need of a humanitarian aid. So yeah, there is urgency somehow. There is a door there that can be built on. But what I am afraid of is regimes so far and militias have been much faster in capturing this moment and capitalizing on it than UN envoys. I'll come back later if there is any question, but thank you.
Thank you so much for that, Farah. That was a very, very concise yet insightful look into what's happening in Yemen. I think it gives people a good, at least, taste of what the initial response is looking like. So just a reminder for all of you who are joining us, if you would like to send questions to the panelists, you can do so either through Twitter using the hashtag COVID-19 Justice, or you can do so through the question and answer function in Zoom, and we hope you have questions. We won't be able to get to all of them. We have about 19 minutes left together, but we can address some. So I'll just begin with a question to both Farah and to Azadeh. Some of the words that, we've spoken a lot about the vulnerability of populations and people to this virus. Some of the word that has come up a lot in conversations around the pandemic is interconnectedness, and how a threat to one or a threat to few can quickly become a threat to many. We've even seen political leaders affected and harmed by this virus. How do you see political leaders in both Yemen and Iran responding to the situation? Are they taking into account that sense of interconnectedness? Are they using this moment to come to greater dialogue or to make some positive changes, or do you see them using the moment differently? Farah, why don't you begin, since you were just speaking?
I mean, the thing is, that's what I would like to think. That's what I want to pray for. It doesn't seem the actions really on the ground kind of really tells you that, makes you excited, or actually see that, finally everyone is noticing how stupid the wars we have been fighting, and now there is a war that, if we lose that framework, that really threatens all of us. My information is there are some breakthrough, but I think the problem with Yemen also is the conflict is partially civil war, partially proxy war, and partially everything else. And then you need a lot of layers to be able to really kind of knock down this conflict. But what is possible, in my opinion, and it's a bit of a repetition, is to use it as a breakthrough, the exchange of prisoners. And that's because that's very important, but that's also feasible, and there is benefits for both sides in doing that. So far, the indifference of both sides is scary, and I haven't seen really strong actions on it. But overall, we shouldn't, I think, in my opinion, when it comes to warlords and war sides, we should never really gamble on their upper hand. In their upper, sometimes they will wake up and think, we should stop doing bad stuff. I think more of pushing them into kind of having a buy-in for peace. You can't really gamble on these people's intentions, good hopes and good thoughts. If they had them ever, you would never start this war. I do think somehow there is a way to start probably de-escalation measures like the exchange of prisoners, and that's not bad if it happens. It's very important.
Azadeh, what about you?
I think on Iran, there's certainly been cause to be hopeful, witnessing some of the developments that have unfolded since the pandemic hit Iran. I think one fact about Iran, and the fact that Iran was a sort of transmit point to a lot of countries for the virus, underscored that Iran is like this big 80 million country at a very significant geostrategic crossroads. It ends up being dangerous, isolating and blockading Iran and pretending that it has no legitimate security aspirations, trying to choke it off economically. I think we saw the cost of that in the way that Iran, as its sort of Silk Road's, pivotal role, ended up spreading the virus. I think there's been a couple of things. I mean, on dialogue, I think there has been important dialogue with Europe, and we can see through the activation of the humanitarian channel that I talked about. And then on the side, you've seen Iran release or furlough some detained Iranian dual nationals. We've seen that there's been space for a release in exchange for, I think, essentially the activation of this humanitarian channel. I think Iran's leaders are certainly trying to use this moment. I mean, they're finally getting some attention around the cost of sanctions. I mean, they've been going on about this for months, years, but finally there's traction because everyone is confronting a similar threat, and Iran's particular vulnerability, I think, is on display, and it wasn't before. So they're sort of, I think, getting a hearing on sanctions and are really trying to leverage that and maximize that. And I think there's been resonance. I think you hear calls to lift sanctions. The Pope called for the lifting of sanctions. There's a very broad-based signature group of signatures, including the Democratic nominee for President Joe Biden, calling for sanctions for Iran to be lifted right now in reflection of the pandemic. So I think that there, sort of tragically, it has afforded an opportunity for some movement on some of these points. Things that Iran has been asking for, sort of opportunities for a back and forth that hadn't really presented themselves before, given the state of the deadlock. And I think Iran is looking very much ahead to this IMF loan as a way to marshal some of the attention and support it has gotten around the impact of sanctions on its population, and to push for this. And I think it will be very important to watch as we see countries, as we see Europe also, and countries like Iran try and figure out how to navigate this situation they find themselves in, where the impact of US sanctions has this sort of totalizing effect on their prospects as a nation. Whole continents like Europe find themselves very much not on board, but also squeezed because of the power of the US economy. So in a way, I think Iran's fate with this in this moment will have a lot of political implications to come in lots of different ways.
Thank you for that. We have now a question for Cordula. The question basically asks, how should we consider the role of non-state armed groups who control access to public resources in areas of territory? What are some of the issues that should be prioritized with non-state armed groups, and what are some of the particular obligations that they have in the current moment?
So as parties to conflicts, non-state armed groups, of course, have the same obligations to provide for the basic needs of populations under their control. So if non-state armed groups have control over territory, as we have in certain places like Yemen, the Ukraine, and other places. So that's sort of the first obligation, and then they have obligations specific, for instance, to detainees, to treat detainees humanely, to provide also the healthcare to detainees. But of course, the problem is often a problem of capacity. And for instance, when we think now, and Azadeh was, and I'll give it as an example, maybe Azadeh was mentioning earlier on the situation in northeast Syria, where of course, you have camps, for instance, in particular the camp of Al-Hol, where we have and now I think 60,000 people, 2/3 of 60,000 people who are almost all women and children, and there just simply isn't the capacity to to have the basic needs for these people. There isn't also the capacity to detain other people in conditions that are according to even the most basic standard of Common Article 3 to the Geneva Conventions, let's say. So in those situations, then you have an obligation to allow and facilitate what we call humanitarian relief. What does this mean? So this is also an obligation of governments. Of course, it's an obligation of all belligerents, which says that in armed conflicts, impartial humanitarian organizations have a right to offer their services to the belligerents. And And when those services are truly impartial and humanitarian, they should be, well, they have to be consented to, unless, yeah, exactly, unless, for instance, they're not impartial. So let's say you're only proposing services for one specific religious group or one politically affiliated group or something like that. Now, of course, belligerents can still impose measures of control. So, for instance, the government can impose public health measures. Same for a non-state armed group. They actually have an obligation probably to impose public health measures in such a situation. And so then it's a question of balancing of, on the one hand, taking measures to stop the virus, or at least stop the spreading as much as possible, and at the same time not basically being self-defeating and thereby completely depriving people of humanitarian access. So in the camp of Al-Hol, for instance, the ICRC is still working in that camp, trying to help have better sanitation, continuing to have a field hospital, etc., etc. However, the reason why I'm also mentioning this camp is because it's also illustrative of the limitations that there exists. And this camp, for instance, is a camp where people shouldn't be, this is not a place where children in particular should be. And the ICRC, for instance, has called particularly for third countries, so those who are not Syrians or Iraqis, to repatriate their nationals, because this is just not a place where they will be able to live according to standards that are necessary, particularly children, but also women. And so, there is a limit to what can be done in situations of armed conflicts, and you have to be realistic about the expectations, in particular expectations towards non-state armed groups, and in that particular situation. I think the best course of action would be for third countries to repatriate their nationals. Now, this was already difficult before COVID. I don't think it's going to get any easier. But I think it needs to, that conversation needs to continue, and it needs to be to remain on the agenda.
Thank you. And we have a quick follow-up or another question for you while you're up. One person has asked, how can IHL be interpreted to secure the obligation to facilitate unimpeded access to humanitarian aid in light of the many travel restrictions and border closures that are being introduced to combat the spread of the pandemic? So
yeah, that's a very good question. And again, I think it is about finding a balance. So as I said, once you have an offer of services of impartial humanitarian organizations and consent by the parties, it is obvious that parties can still impose measures of control. So these, let's say, talking before the public health issues, these can be measures, for instance, so that humanitarian aid isn't diverted to military purposes, or that, to prevent corruption, to ensure, for instance, that medicines are according to the proper standards required, etc. So there are clearly administrative measures that states and belligerents can impose on humanitarians. Now, public health measures, such as the ones on lockdown, on freedom of movement, restricting freedom of movement, restricting freedom of goods, are also measures that in themselves are probably are legitimate in order to curb this pandemic. But a balance then needs to be found between those legitimate measures and the right of people to be ensured their basic needs. And so if those measures lead to a de facto denial of consent to humanitarian relief and a complete deprivation of people, say people in IDP camps, detainees, etc., of their basic needs, if people thereby are completely denied food, water, medical care, then that balance isn't there. It's not easy to, and that needs to be decided really case by case in each different conflict situation, it's a question of a constant dialogue also, I think, between, you know, international humanitarian organizations, local organizations which have a big role to play, and governments. What I can say though is that, for instance, the ICRC has received quite, you know, has received some exemptions to such restrictions. So, for instance, on we've been able to transport goods to Somalia, or, you know, in Nigeria, we've been able to also transport goods to people. We've had exemptions in certain other countries. We've been able, for instance, also to bring humanitarian relief across the front lines in Ukraine to the Donbass. So we have had some success in getting those exemptions. It remains to be seen whether there is a trend of humanitarian relief being impacted negatively by COVID. So far, we can't I think, judge that yet. So I think it is a question of dialogue, and very often that dialogue can also lead to better exemptions. I have to say though that at the ICRC, the thing we are struggling the most with is international movement of our staff. We have a lot of international staff, and it's extremely difficult to move them around in order to do our job.
Of course. I have one. This will be our last question as we're running over time. But for Kate, this is a question posed by a journalist who has asked the White House and the State Department about the proposed global ceasefire, the ceasefire proposed by the UN Secretary General. In response, he has learned that, or he has received the response that the United States supports the Secretary General's call for a global ceasefire, that has noted that we will continue to fulfill our legitimate counterterrorism measure. Can you weigh in on this kind of contradiction about both participating in a global ceasefire and yet continuing a global war on terror?
Sure. First and foremost, you can't support a call for a ceasefire while continuing military operations. That first and foremost are going to have an impact not only on the people living in the countries where the United States is at war, but also carries the threat of spreading the virus further, not only to impacted populations, but other warring parties, as well as US service members. And so I think it shows the continued hubris of the United States government to think it's an exception to the global rules and norms that we say we want to support, but ultimately often end up violating or ignoring when it suits our quote unquote national interest. And I think that is where a key failing of the United States that not only undermines its credibility on the international stage in terms of leading efforts for global cooperation or recognition of human rights, or the realization of universal human rights, but also it ultimately makes the United States less secure. This is a key moment to be recognizing that conflict and violence are not resolved through more violence. We have over 2 decades of this point of trying to resolve and prevent conflict through the use of violence. And if anything, that's exacerbated the security challenges and the violence in dozens of countries around the world. And so this pandemic not only shows that it's a time for a rethink to actually perhaps, beg the question, does the threat posed by violent groups that perpetrate terrorism actually have a military solution? Or should the United States be taking this opportunity to perhaps rethink its approach fundamentally and focus on actually addressing local drivers to conflict, which are often rooted in governance failure, lacking economic opportunity, poverty, and other things that drive the influence of these groups and make individuals susceptible to recruitment. And finally, I think if we are trying to lead by example or set the rules of the international system, we have to hold ourselves accountable. And so by the US declaring a ceasefire, we could have a very positive impact on other parties around the world who are in conflict and send the signal that we have the expectation that they do the same.
Thank you. And thanks to all of the panelists for a very vibrant discussion and for your contributions today. We've covered a lot of topics, a lot of ground, and I think we could speak for much longer, but unfortunately we'll have to end here. I'll close with a couple of reminders. There is a recording of this event and closed captioning, which will be available at the series website, which is tinyurl.com/COVID-19 Justice Series. And secondly, we didn't get to discuss too much the situations of refugees and migrants and asylum seekers, but we will have an excellent event tomorrow at the same time, same Zoom setting, and a particularly timely topic given Trump's announcement of the immigration ban. The discussion will focus on COVID-19 and its response, risks to refugees, migrants, and asylum seekers, and we hope that you can join us for that as well. Thank you so much for joining us.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Thanks all.